Your body is always sending signals, some obvious, some subtle. Ignoring the wrong ones can have serious consequences. In this video, you'll learn 6 crucial body signs you should never ignore. Sign number 6 is one most people overlook, and it could save your life. Let's get started and learn to really listen to what your body is telling you. Chest discomfort isn't always dramatic, presenting as a crushing weight or sharp stabbing pain. Sometimes, it can be subtle, a mere twinge or ache that's easy to dismiss. But even seemingly minor chest discomfort shouldn't be ignored. Because even if it feels insignificant, it can signal something serious, potentially indicating an underlying heart condition or other health issue that requires prompt attention. Understanding the nuances of chest discomfort is crucial for proactive health management. It might feel like tightness, a constricting sensation that makes it difficult to breathe deeply or comfortably, or pressure, a heavy, squeezing feeling as if something is pressing down on your chest. This pressure can be localized or spread across a wider area, or even mild burning, a sensation that can easily be mistaken for something else. It's sometimes mistaken for indigestion or muscle strain, leading people to delay seeking necessary medical attention. Differentiating between these conditions and potential heart-related issues is vital. If you notice new, severe, or persistent chest discomfort, especially if it's accompanied by other symptoms like shortness of breath or dizziness, don't tough it out. Get checked by a doctor. Early diagnosis and intervention can significantly improve outcomes. Heart-related pain can be subtle, often presenting differently than the stereotypical image of a heart attack, and may radiate to your arm, particularly the left arm, although it can occur in either arm, or jaw, causing a dull ache or sharp pain that can be easily confused with dental issues, or back, often between the shoulder blades, creating a persistent discomfort that's difficult to pinpoint. Women and younger people often experience different symptoms, which can lead to delays in diagnosis and treatment, like fatigue or nausea, symptoms that are often attributed to other causes, such as stress or a viral infection. If you have risk factors, high blood pressure, diabetes, or family history of heart disease, your threshold for seeking medical attention should be even lower. Don't wait. Proactive monitoring and early intervention are key to managing your heart health effectively. Tests like EGCGs or blood work can provide valuable insights into your heart's function and overall health. These tests can rule out serious problems and give you peace of mind, allowing you to focus on maintaining a healthy lifestyle. Sometimes, chest pain is harmless, caused by something as simple as muscle strain or heartburn. But only a doctor can tell for sure, providing an accurate diagnosis and appropriate treatment plan. Take note of when the discomfort happens, what activities you were engaged in, and any other symptoms you're experiencing. And what makes it better or worse, whether it's rest, medication, or specific movements. This information can be invaluable to your doctor. Don't brush off chest discomfort. It's always better to err on the side of caution when it comes to your health. Your health is worth the extra attention, and seeking medical advice can provide clarity and peace of mind. When in doubt, reach out to your healthcare provider. They are your best resource for accurate information and personalized guidance. Our vision is a precious sense, one we often take for granted until something goes wrong. Sudden changes in vision, whether subtle or dramatic, can be a cause for concern and should never be ignored. Experiencing blurriness, where the world seems out of focus, double vision, seeing 2 images of a single object, or temporary loss of vision in one or both eyes, can be alarming and requires immediate attention. These are red flags, warning signs that something may be seriously wrong with your health. These symptoms can signal a range of underlying medical conditions, some more serious than others. From common migraines, which can sometimes be preceded by visual disturbances, to potentially life-threatening strokes or retinal problems, such as a detached retina, which requires immediate surgical intervention to prevent permanent vision loss. If vision changes come on quickly and unexpectedly, don't delay seeking medical attention. Seek help immediately, as time is of the essence in many of these situations. Flashes of light, the sudden appearance of floaters, those small specks or threads that drift across your field of vision, or a shadow suddenly appearing across your vision, obscuring part of what you see, could mean a detached retina, a serious condition where the retina separates from the back of the eye. In such cases, don't wait. Immediate treatment is crucial to preserving your vision. Conditions like diabetes and high blood pressure, if left uncontrolled, can also cause significant vision loss, often through diabetic retinopathy or other vascular problems affecting the delicate blood vessels in the eye. Therefore, regular comprehensive eye exams are vital for early detection and management of these conditions. Sudden vision changes accompanied by weakness on one side of the body or trouble speaking clearly and understanding others may indicate a stroke, a medical emergency requiring immediate intervention. In such a situation, call for help fast. Every minute counts. While eye strain from prolonged screen use is common and usually temporary, sudden or severe changes in vision are definitely not normal and warrant a thorough evaluation. Remember, your eyes can reveal a lot about your overall health, acting as a window to potential underlying issues. So pay attention to them and listen to what they're telling you. Don't ignore sudden vision changes, no matter how minor they may seem at first. Prompt action and timely intervention can often save your sight and prevent further complications. When in doubt, or if you're at all concerned, it's always best to get checked out by a qualified eye care professional. Blood in your stool is never something to ignore, even if it feels awkward to talk about. Bright red or dark, tarry blood can signal anything from hemorrhoids to serious conditions like colon cancer. Persistent or large amounts of blood or symptoms like weakness or dizziness require immediate attention. Early detection of issues like polyps or inflammatory bowel disease can make a huge difference. Your doctor may recommend tests like a stool sample or colonoscopy to find the cause. Don't self-diagnose. Get a professional opinion. Embarrassment shouldn't stop you from seeking help. Mention any blood in your stool to your doctor. It could be nothing, but it could also save your life. Swelling in one leg, especially when it appears suddenly and without an obvious cause, can be a warning sign, a signal from your body that something might not be right. It's easy to dismiss it as a minor issue, but it's crucial to understand what it could indicate. Of deep vein thrombosis, a condition often referred to as DVT. This is where a blood clot forms in one of the deep veins of your body, most commonly in the leg. A blood clot that can become life-threatening. If left untreated, it can dislodge and travel to other parts of your body, causing serious complications. Look for swelling, particularly if it's accompanied by other symptoms. Tenderness, a pain or discomfort that worsens when you touch or apply pressure to the affected area. Warmth, an unusual feeling of heat in the swollen leg, often noticeable to the touch. Or color changes in one leg, such as redness or a bluish tint, indicating impaired blood flow. Especially after long periods of immobility, like a long flight or sitting at a desk for hours. These situations can increase your risk of developing a clot. If the clot travels to your lungs, a condition known as a pulmonary embolism, it can cause sudden shortness of breath or chest pain. Both are critical symptoms that require immediate attention. Seek help immediately. Don't delay. Pulmonary embolism is a medical emergency. Risk factors include recent surgery, which can temporarily increase the likelihood of clot formation. Immobility, pregnancy, due to hormonal changes and increased pressure on the veins. Obesity, certain medications, like birth control pills or hormone replacement therapy, and family history. If someone in your family has had DVT, your risk may be higher. To lower your risk, move regularly, especially if you have a sedentary job or lifestyle. Stay hydrated, as dehydration can thicken your blood and increase the risk of clots. And consider compression stockings if you're at higher risk. These can help improve blood flow in your legs. If you notice these symptoms, don't ignore them. Early detection is key to preventing serious complications. A quick ultrasound can diagnose DVT, providing a clear picture of the blood flow in your veins. Early treatment with blood thinners, also known as anticoagulants, can prevent complications such as pulmonary embolism and reduce the risk of long-term damage to your veins. DVT often develops quietly, with symptoms that can be subtle or easily mistaken for something else, so trust your instincts if something feels off. If you have a persistent feeling that something isn't right, it's always best to get it checked out. Swelling in one leg isn't always serious, and there can be many benign causes. But when it is, time matters. The sooner you seek treatment, the better the outcome is likely to be. Listen to your body, pay attention to any changes, and don't hesitate to seek medical advice. And seek help if you're concerned. It's always better to be safe than sorry when it comes to your health. Awareness can save your life. Knowing the signs and risk factors of DVT can empower you to take proactive steps to protect your health. Sudden confusion or forgetfulness isn't just aging, it can signal a serious medical issue. Disorientation trouble recognizing faces or rapid changes in memory are red flags. Causes include infections, low blood sugar, dehydration medication, side effects, or stroke. These symptoms can appear suddenly, even in someone who seemed fine before. Family members often notice these changes first, don't ignore them. Quick action and medical evaluation can often reverse confusion if the cause is treated early. Confusion is a symptom, not a normal part of life. Speak up if you notice sudden changes in someone's mental state. Early intervention can make all the difference. Bleeding gums or persistent bad breath are more than dental issues. They can signal problems throughout your body. Gum inflammation is often caused by plaque, but untreated, it can lead to gum disease and even affect your heart or diabetes risk. Bacteria from your mouth can enter your bloodstream, increasing the risk of serious health problems. If your gums bleed or you have ongoing bad breath, see your dentist. Regular cleanings and proper flossing are essential for gum health. Crunchy fruits and veggies, staying hydrated, and avoiding tobacco all help. Gum disease can develop quietly, so pay attention to early signs. Taking care of your mouth protects your whole body. Don't ignore what your mouth is telling you. Your body whispers before it screams. Don't ignore the signs. Every odd symptom is your body asking for attention. Protect your health by paying attention and acting early. If this video helped you, like, subscribe, and share it with someone who needs this reminder. Start listening to your body and encourage your loved ones to do the same. Every small step brings you closer to lifelong well-being. Your body speaks in silent signals sometimes. Discomfort in your chest is more than just stress. A persistent ache or tightness in your leg. Don't brush it off. This could be your body alerting you to something serious beneath the surface. Notice a tremor or weakness that wasn't there before. It's not always just nerves. Listen closely. Memory slips and confusion can be more than just aging. Your brain's health matters. Don't ignore these moments. Swelling and pain in your joints are your body's way of waving a red flag. Early attention can make all the difference. Every sign, no matter how small, is worth noticing. Trust your intuition and seek help when something feels off. You know your body best. Ready to support your journey to better health? Meet Nagano Tonic, the natural daily boost inspired by centuries-old wellness traditions. Nagano Tonic combines time-honored herbal wisdom with modern science. Every bottle is crafted for purity, potency, and real results. Feel energized, focused, and balanced every single day. Nagano Tonic is designed to fit seamlessly into your lifestyle. Join thousands who've made Nagano Tonic part of their daily routine and discovered a new level of wellness. Your health journey starts now. Visit link in the description and unlock your exclusive offer. Take the first step. Nagano Tonic is here for you.